Wait, I have to pay taxes on my gambling winnings?
Yeah.
Can I deduct my gambling losses?
I'm not an accountant. This is not financial advice. Next question. Wait, so you guys prefer to use brand name drugs with patients, or do you use a trusted compounding pharmacy?
It's interesting because there are a lot of clinics out there that say, oh no, we don't send prescriptions to your pharmacy. We use our trusted compounding pharmacy. But yeah, I guess the secret is out. It's true. We told people about it. We do generally prefer to use not necessarily brand name drugs, but at least FDA approved drugs, generic drugs, where we know the batch to batch reliability meets certain standards. It's within 80 to 125% total drug exposure, area under the curve. Whereas we don't have that with compounded medications. And there are some things you can only get compounded, and there are cases where people do need substantially lower doses of something than you can get in a FDA-approved formulation. So I guess the answer is yes, but we also do have some trusted compounding pharmacies.
Yes. More compounding pharmacies than not, we do not use. So we do only use a handful of compounding pharmacies, but for a completely different reason, candidly, than other clinics. I don't know of any other clinics that just charge the patient what the price of the medication is at the pharmacy. So we don't have skin in the game. So we're not financially incentivized to send medications here, there, or anywhere else. Whereas any other clinic outside the conventional health system likely is. So think about that as you're choosing a healthcare provider as a hidden cost or fee. Just like if you go to Las Vegas, you have to think about like resort fees and excess taxes and fees, and there's like all these hidden costs.
Wait, I have to pay taxes on my gambling winnings?
Yeah.
Can I deduct my gambling losses?
I'm not an accountant. This is not financial advice. None of this. And even though I am a doctor, this is not your individualized medical advice. And Mark Bell the other day was talking about, this and that, because he had his YouTube channel banned. And he said something like, and I'm not a doctor, so this is medical advice. And I thought about saying, well, I am a doctor, but this is not your medical advice.
I think that's fair.
Yep.
Maybe we can make that into the outro.
Yeah.
Maybe for the After Hours podcast.
Seems good. But anyway, the kind of hyper extreme example that we used about compounding pharmacies is one of our patients that has diabetes and no insurance, and also is not in a position to buy full priced or even couponed GLP-1 of any sort, but also does not meet the income criteria for the assistance programs. Because, Eli Lilly and Novo Nordisk, they have these assistance programs, which have also had patients use in the past. So if you're a Eli Lilly or Novo Nordisk fan, that's fantastic. We love you. We're also a fan. We're always following the latest updates of whatever billion-dollar med that your companies are buying. But there is patients that fall in between, and the best thing that you can do to care for them is prescribe a compounded GLP-1, believe it or not.
Yeah, there is a patient for which that is the best medication intervention.